Hello, my name is Caitlin, and I'm going to be talking to you about neonatal nursing, caring for neonates, and the NICU. Many people would say that nursing in general is definitely a difficult field as well as an important field to go into, and that it takes a special person to become a nurse. I 100% agree, and I believe that it takes a special person to go into the neonatal nursing because they have to work with the preemies and they have to deal with all the emotions and the stress. And not only are they dealing with their emotions, they're dealing with the parents' emotions, trying to keep the parents calm and relay messages back and forth. There's a high demand for nurses, possibly even more of a high demand for nurses for the NICU. The neonatal nurses' primary patients tend to be sick premature babies that need to be cared for and monitored for several months or weeks until they go home or die, which that is a very sad thing. When working in the NICU, you never know if you're going to get a baby that's going to have so much wrong with them they don't make it, or one that has so much wrong with it but gets better and goes home. You never know. It's one of those things. It's very emotional. The nurses feed, monitor, and care for the babies, as well as are the parents' emotional support system, and have to communicate with the parents and let them know what's going on and give them comfort at their time of need. According to the National Association of Neonatal Nurses, there are approximately 40,000 low birth weight infants born each year in the United States. The survival rate of the neonates is now 10 times better than it was 15 years ago. That's good. And being a neonatal nurse working in the intensive care unit for the neonates is one of the most difficult and important jobs due to everything that comes along with it for reasons such as the protocols and formalities, the levels of neonatal care, emotions and morals, and the roles of a neonatal nurse. And I'm going to show you a few pictures. So, can you see that? This is just a picture of the neonate. This picture is actually my little brother. He was a premature baby. He came 2.5 months early and was in the NICU for about a month. And throughout the speech, I'm going to go over the NICU, what basically is the NICU, and about neonatal nursing, their salary, that kind of thing, protocols and formalities, emotions and morals. So the NICU stands for the Neonatal Intensive Care Unit, and a neonate is a baby that are 4 weeks old or younger, and they're also called newborns, which you probably already knew. During this time, the changes are rapid, and the neonatal period for babies is their first 4 weeks of life. Critical events occur during this time, such as their feeding patterns and bonding with the parents and the baby. Risks for infections are more serious and higher. And then higher and birth and congenital effects are definitely noted. So effects that are born and then congenital effects. Preemies definitely weigh less than a baby that comes full term because their body hasn't had the time to sit there and gain the weight and develop like it should. There are 4 levels of neonatal nursing. There's level 1, level 2, level 3, and level 4. And now I'm going to go over what a neonatal nurse is. So the NICU nurse basically primarily cares for the sick premature baby who needs the care, and sometimes for weeks and months until they go home. But not all of the patients, like I said, live. The salary for the nurses, their average salary is about $74,000. Pretty good to me. To become a nurse for the NICU, of course, for any nursing, you have to apply to the college, go for your RN or BSN. But by the year 2020, I believe, in Georgia, all nurses are going to have their BSN. They're going to be required to. If they don't, they're going to have to go back to school for it. And you have to take, so once you apply to college, you got to take your core classes, and then you have to take your HESI-A2 or your TEAS test to get into the program, depending on the college. So that's the entrance exam for the nursing program. Then you have to go into the nursing program and take those classes. You have to pass those classes. Then you have to take your boards and your NCLEX, and you have to pass both of those to be qualified. And you have to have about 12 clinical hours. No, 2 years of clinical hours or more for experience purposes. And what it's like to be a neonatal intensive care unit nurse. For the neonatal nurses, it takes a lot of work. Someone that has a kind heart, strong drive. It's very time consuming, stressful, emotional, can cause moral distress. Their shifts are about 12 hours. I know when my brother was in the NICU, they changed shifts at 7 a.m. and 7 p.m. So the nurses were there from 7 a.m. to 7 p.m. and then the nurses came in from 7 p.m. to 7 a.m. That's how their shifts went each day, like a routine. And being a neonatal nurse, you work days, weeks, nights, weekends. Your free time is pretty much gone. You're revolving around the care of the preemies and taking care of them and their families. You need to also be empathetic and sympathetic, and you have to have good communication skills to work into the NICU because you have to communicate with the parent. You don't want to accidentally relay a message wrong or relay it away so that the parents freak out more. So you want to be able to use layman terms, not doctor terms or nursing terms. And there's definitely a lot of different requirements that continue to come up for nursing each year. Each year is more and more competitive to get into the nursing program. I know it's very competitive. You have to be smart, you have to study. So if you're going to be a NICU nurse, you definitely need to study and put forth the effort. So for the morals and emotions part, the neonates and infants have the highest death rate for pediatric population. And a lot of babies that are born die within the first year of their life, which is really sad. Some conditions the neonates face are chromosomal abnormalities, congenital and low birth weight, and then low birth weight is definitely common among preemies. Most preemies don't have a high birth weight. My brother was 3 pounds and maybe 4 ounces, I want to say. I can't remember the ounces, but I know he was definitely 3 pounds when he was born. And like I said, he came 2 months early. And then when you're caring for the preemies and neonates, like I said, it can cause moral distress. There's a lot of emotions involved in caring for the neonates because not all the babies make it home. Some die, some don't. And that can definitely take a toll on a person. But moral distress occurs when a nurse is prevented from translating moral choices into moral action. Such events can result in anger, guilt, frustration, powerlessness, and your self-worth might be jeopardized in this case. When moral distress is not addressed, the nurse's self-worth is jeopardized, affecting personal and professional relationships. That's from Kane. Moral distress occurs in critical care nurses, pediatric nurses, and maternal child health nurses. So, moral distress can occur in regular nurses, but I feel like the higher moral distress is in the NICU because you're working with the tiny preemies, and that's very, very emotional. I'm not saying that working anywhere else would be less emotional or not emotional at all, but to me, working with the babies would be more emotional than any of it. And that's just me personally. Just from me going in to see my brother when he was in the NICU, it was pretty sad to see all the babies there with all the little devices in their head, IVs in their heads, feeding tubes. They had all these different things hooked up to them and in their incubators and all along, some of them. So I think the more distress is higher there, as well as all the emotions. And then the protocols and formalities. When it comes to being a neonatal nurse working in the NICU, there are certain protocols and formalities that you have to follow. Neonatal nursing practice consists of three things: implementing nursing therapy, collaborating with other healthcare providers, and assisting with medical care. So you'll definitely have direct supervision. You'll need to be able to have independence and be able to communicate and translate care. Then there's your legal aspects: malpractice versus negligence, your statutes of limitations, and your standards of care. Then you have your neonatal assessment. So you have to have an accurate assessment that is the pulse oximeter and the transcutaneous oxygen monitor, followed by correlating the gas blood study or blood gas study. This assessment is all over the organs and organ systems of the neonate's body. Then, basically, I'm going to give you an overview. Neonatology is a huge field of study. After reviewing the information obtained about becoming a neonatal nurse, preemies and neonates, and the neonatal intensive care unit, many people would say that nursing is a difficult field of study and it takes a special type of person to become a nurse, but even more so to be a NICU nurse and work with the neonates. The neonatal nurses are dedicated to what they do. The nurses care for the sick and dying babies, and some of the babies live a healthy life and some do not. There is a high demand for nurses, and possibly, like I said, even more so a high demand for the NICU nurses. And I told you that the primary patients are sick premature babies that are in the NICU, and being a neonatal nurse working in intensive care unit is one of the most difficult and important areas due to everything that comes along with it. That's just my personal opinion. And that's basically the gist of neonatology and caring for the neonates and the intensive care unit and the NICU. So there we go. Thank you.